Okay, so the first part of cleaning the surgery room, I like to think, is cleaning everything off. One thing including is the drapes. Best thing is to spot clean as best as you can. I use a damp brush, sometimes hydrogen peroxide on a little gauze pad. If it's too badly destroyed, there are blue drape material right in the corner to the right of the autoclave. I will show that, but right now we are using one that I spot clean, and that is all dry. There's a particular way to fold it, and that's what I'm going to show you today. So firstly, start off horizontal fold or hot dog, whatever works, and then you go vertical fold right across. So you're doing 1/2 fold down, 1/2 fold across. Make sure to keep track after you fold this in. This is your middle part, so I like to keep this folded so I can keep track of it. Next part is you fold it again, vertical. So 1 down, 2 vertical, and then, shockingly, third one is also vertical. So now we have our little corner piece that we tucked. So I flip it on its back, I make sure that it's the one showing, and you just kind of fold it so it ends up like this. Very cool. And that is that. Next is the gowns. Oh, ignore the note. Next is the gowns, which also have a very particular way of being folded. So I like to flip them where the front is facing forward or facing up. First thing I do is I fold the sleeves in, both. Like that. And then I will take one side and I fold it in. And then I take the other side and I fold it in. The goal is you want the front to be the most sterile, so you keep that tucked in. Next, you fold it in again. So 2 different halves, same thing on the other side. Fold it inward, just kind of fixing it as you go. And then last part is to connect the 2 halves and fold them over each other. I like to just kind of flatten it out as I go along. So same thing with the drape. You fold, you keep the top up. Doesn't matter with this one because both sides are the top. And you fold in a zigzag, like so. And then I like to fold it over just another time, and then just so the doctor can easily pull it up. And that is that. Another thing about the drapes, these can be washed. I don't really like to put them in the dryer. My little trick is I keep the table warm, so I keep it plugged in, and after I wash it, I bring it on the table to dry, and then I fold it, and then, so that is that. Okay, the next part to closing / cleaning the surgery room is the packing of both the gowns and the tools for the autoclave so that they're sterile for their next use. Right now we are packing the general pack. This includes 2 towel clamps, 4 mosquito forceps, 2 tweezers. One is straight, the other has 2 little pinchies. This is the rat tooth comb. This is the other one that I'm blanking on the name. You have scalpel handle, curved scissors, straight, and suture scissors. So that is all of the tools that you have for the general pack. The other things that go in the general pack are a singular drape and these sterile strips where you could find to the leftmost drawer to the sink. where the tape and Sharpie and everything else are, as well as 10 counted gauze. So first thing that you do is, I like to leave the towel clamps last because they like to hook on other instruments, so I like to leave them last. So I start with the 4 forceps. I just kind of collect them like so. And then it's your curved, straight, and suture. And then afterwards, I like to put the towel clamps on top. Each have a very particular order of how they go. Next is your scalpel blade. And depending on how you lay the tools, you want it through the back handle, if that makes sense. So they lay flat like this. If you do it the other way, they kind of curve upward a little bit, which is fine. It's just, whatever works for you. This I found is the easiest, so they lay flat like that. So you got all of your tools there. Let's move this over a little bit. Lastly, I put the little tweezers wherever they could fit, so I either do one on each side or both near the suture scissors. Next, you have your gauze. I place the gauze on top. Be careful of tools slipping out. Just, if that happens, just pull the scalpel handle a little bit towards the other side, not too much, like so. Next is your drape. Remember the corner fold. I try to put it where I'm covering all the tools. Sometimes that doesn't happen. No need to worry. Just cover as much as you can. And then lastly, you have your sterile strip. I like to flip it and fold it so the people who are opening the pack, whether it's the techs or the doctors, they could see that this will be sterile because the K will be filled in. Next is the folding part, is what I like to call the fun part. But you take the bottommost fold closest to you, and you pull it really tight and you fold it over, slowly moving your hand out, checking the tools are still there. And what I like to do to make sure it stays tight is to put one hand over, and then you fold it back, and you keep folding that until you have just a little flap where somebody could easily pull it, all the while keeping at least one hand to keep the tightness of it. Next, you go to the right side and you fold. Same thing, super tight, slip your hand out. I just like to straighten it up a little bit, fold over. I like to fold over either 2 or 3 times. And then this is the left side of it. Now pointed towards me, I'm pulling it super tight, folding it over. Same thing. And then for the last part, I like to keep turning it just so it's easier for me, but this was originally the top portion. Same thing, you're gonna pull it super tight, but instead of folding it over, you've created this little pocket right there that you just kind of stick it in. Always leave a little dog ear flap so whoever can just pull it out. And that is our first layer. With a general pack, you always use a small cloth and a medium-sized cloth, both found underneath the autoclave. So same thing, or, oops, sorry, I almost forgot. Always place the dog ear pointing to the left. So put it in the middle, dog ear to the left, and then same thing, start at the bottom, fold over, keeping one hand down, and then to the right, fold over. This is the left side, and then this is the top, and then same thing, just kind of tuck it in there, leave a little piece where somebody could grab it, and that is your folded general pack. One thing left is a piece of tape. Anytime we make a pack, or anything really that goes in the autoclave, it's labeled. Usually it's labeled what it is, the date, and a signature. All super important. For a general pack, it's G/P, and then just the date, today's date, and your signature. All right, that is your finished general pack. Next up is the gown and towel, which is what you use a medium cloth and a large one for the outside. So with your medium cloth, you place your gown on top. Doesn't really matter which way. I like to put it facing the left. Doesn't really matter. And then instead of a drape or anything, a blue towel found where the cloths are under the autoclave is placed on top. And then also another sterile strip. I like to make a little ear so you can kind of just tuck it in. And then same thing as the general pack. Start from the bottom, make it really tight, fold over. And then starting to the right. Now the left. And the more you do it, the faster you'll get, so don't worry, take your time, and if there are anything that comes up, or if you think you're missing a tool or an extra tool just showed up, please ask. It does not hurt to ask. Yeah, so that's our first layer. Next, I'm gonna lay out the large cloth. Same thing, dog ear to the right. Start at the bottom, fold up, over. I like to straighten it out so it's not all wrinkly, or not too bad at least. And then same thing. With the large ones, it's kind of hard. You could fold them a lot more than you can with the medium or small size. And then just the main thing is you want everything to be kept in really tightly. You want to keep it as sterile as long as possible until the doctors or somebody open it for surgery. So super duper important that you have your other hand there when you fold it so you could keep that tightness. And then last one. Tuck it in, and then same thing as the general pack. To finish it off, you have a piece of tape. We always like to fold the end of it. It just helps whoever pulls it off. With the gown and towel pack, the only thing that's different is it's G/T, and you write the color of the gown. So the color that we folded in was blue. There are blue and green ones. This one was blue, so I wrote blue, the date, and my signature. You just tape it on the side. And that are your gown and general packs. Last thing is extra tools, quote unquote. If it was a spay, it could be a spay hook or a spay pack. They're usually put in these blue sheets, and these are found to the right of the drape material, to the right of the autoclave. Easier when you find it. And anytime that you put something in there, you always write what it is, the date, and your signature. And then really quick, after they autoclave, so these ones have not been put in the autoclave, but when they are done, this is the autoclave, the spay packs, everything is very nicely labeled. Spay packs, spay hooks go in here, as well as these other things. You could always just take a look and familiarize yourself with what's in here. There's also the thumb forceps, needle holders, and hemostats. You got a bunch of other things up here, sterile towels. And if you're ever unsure of what has been used, just take a look in the garbage. These packs will be thrown in the garbage after they're open, or just ask somebody. So the next thing to do in the surgery room is to refill the SIVO tank right here. This is connected to this right here. So what you'll need is in the second drawer, oh, just kidding, I lied. Third drawer, you'll grab a bottle of SIVO and this cool little yellow cap. And the goal is to fill the SIVO line, which is kind of hard to see. It's that right here that it's at right now, to the black line right there. So set this back up. So what you want to do is firstly unscrew the SIVO. You'll see these little yellow hooks right here. The cap has the same things. So you connect those, twist it on like a cap, and then you have this. Next thing to do is the first black thing right here. You twist it to loosen this, you take it out, and you replace it with, on here, the grooves are here, that's facing towards the right. Put it in, and you lock it back up. And then what I like to do is I like to flip it and fill the tube right here before I start filling it. This right here will allow it to go into the tank. So as soon as you do that, you have to watch closely, otherwise it could overfill. So you just kind of slightly turn it. Can't really see right now, but it's filling. And you know it's filling, you see bubbles in the bottle here. And then when you're done, you close it, flip it back down, let all the SIVO drain from the tube, and then twist it to loosen it, take it out, and put it back in, and tighten it again. And then putting it away is the same thing as taking it out. Real cap, third drawer, and push that in. So that is the SIVO. Next thing is, whenever closing this part down, all of this, there are these wires that are usually left out after surgery. And you can see right at the side, there are written what they are. So the black one is right here, is the blood pressure cuff. The other with the 3 hooks is the ECG. So both of those go onto this hook. Big thing is to wrap them in big enough loops where it doesn't damage the wire. So it should, be loosely comfortable around the hook right here. And then on the other side, you have the cap slot, which is not really used, so it should usually be already wrapped up. If it's not, looks like this. And then the SpO2, which is right here. I did not wrap it up yet, but it looks like this. And then the temperature one is the gray cord, looks like this. And it goes on this hook right in the back, right back there. Big thing about cleaning them, I like to kind of spray the alcohol on a little pad of gauze, and I like to wipe it till it's clean. This lives right here next to the SIVO, and then next to it, the hydrogen peroxide. This is garbage, and everything that's up here, this is the glue that lives in this little corner right there. These are the papers for monitoring. If you ever see them getting low, good thing to just print some more. If you're unsure how to do that, just ask the ladies at the front and they will help you out. And let's see. So there are 3 different SIVO tanks. There are 2 in the surgery room, 1 in the dental room, and it's the same thing. You could see this one's already full, or full enough so I don't have to fill it. And then connected to this are these little white bottles, or yeah, and then they're written a number. That's how much they weigh. So when there's a 50-gram increase It's really good to replace these. You could find extra ones of these in the treatment room, which is the room right outside of the surgery room. Next to the sink, it's to the right of it, right top shelf. You'll find a bunch of these. You just grab a new one. If it's not already labeled with a number, you take the scale that's in the same drawer and weigh it. How you check is you grab the scale in the drawer and weigh it, see if so this one, I would replace it at 281, or if it's close enough to that, or is that a 5? No, that's a 3. Yep, 281. And yeah, so that's about it. One of the last things in the surgery room is just putting the packs that we folded into the autoclave. This right here is the autoclave. Big thing is not to let the packs touch the top too much, touch the sides or the back. Otherwise it won't sterilize properly, and it's really important that they sterilize. So with the packs, what you want to do, also check the water hose, make sure it's at the green. If it's not, only use the distilled water found next to it. There should be extra in the drug room, so just take a look. Make sure it's always at the green line. Make sure this is sealed in tightly. What we're gonna do is close it, make sure it clicks. And then there are different types of sterilizing heats and pressures that the autoclave will sterilize the packs in. So what we use are either the pouches or the packs. What we have in right now are the packs. And the packs are 30 minutes fast vent dry. After you hit packs, you just hit start, and then it should say filling chamber if everything is good, and it will autoclave, sterilize everything for you. And then the pouches are only for 4 minutes. The packs are 30 minutes. So after one or the other is done, you just place in the next one. And yeah, next thing is if you ever need to refill the scrub or Chlorohex solution, both of these can be found under the sink in these drawers. The Chlorohex solution is something that we make. It's a gallon of water. Doesn't have to be distilled. This is just the gallon that we use. And 2 tablespoons of Chlorohex, which is right here. So 2 tablespoons, it has to be really diluted. Next thing is if you need to refill the soaps, these right here, and they're found all over the clinic. So just keep in mind when they start to get low, it's the Chlorohex scrub right here. In the Chlorohex scrub with the gauze, what you want to do is mix the Chlorohex solution and a few pumps of the scrub. Mix it in a little, put the gauze in, let it soak, squeeze out the excess and fill it to the top. With the solution, all you want is just what's in the gallon. That's it, no scrub. And then, so all of that is found down here. The other thing, this is the Chlorohex that we use. Other thing is what's in the cold sterile, or the what's used to sterilize the earpieces, the little earpieces that we wash. This is the Benzol. This is also something we make. It is a gallon of water. Same thing, doesn't have to be distilled. It's just tap water. And then we use a whole thing of the Benzol. It's on order right now, but it's usually found just right in front. Everything here is labeled. So when things start to go low, you just replace the label with a little on order sticker, and you place this by the drug cabinet. And I think that's it. Last few things, if there's ever a blood pressure cuff connected to the black cord that we wrapped up here, they live in the second drawer from the top. So just lightly twist and pull to remove them. Your SIBO lives in the 3rd drawer. And I think those are all the drawers that really concern us. And then next thing you know, to close down the surgery room, if this is ever connected to this blue hose right here, this is used for cat surgeries. So it is put away separately. So what you want to do is you flip it, you take the end piece right here and you connect them like so. And then this will live right up here. The other option to possibly see connected to that are these tubes that are used for dog surgeries. So same thing, just disconnect them and put them at the corner, lives right in the corner right there. And then you take that blue tube that connected either the dog or cat bag and you connect it right there. Kind of twist it on so it's a little tight, where it says blue exhaust. Pretty easy, very nice. Next thing you want to make sure before fully closing the surgery room, this is the cord that connects the table. It warms the table up. Want to make sure that's unplugged before we leave the room. And then for good measure, I like to turn it off. And then when you're all done, you just wrap this neatly as you can. At the top, it's a little tangled, so I'll fix that later. So you wrap it right here, make sure that's turned off, and take the garbage out afterwards. And then it's just a matter of sweeping everything, mopping everything, and we're good. Another cool thing is after you wash tools, and if you notice they're a little bit stiff, you could put them in this lubricant right here. You just leave them in there until you're either done washing the rest of the tools or for a good 10-ish minutes. And then afterwards, take them back out, rinse them in the sink, leave them to dry. All the sharps go in here. Blade scalpels, you could either remove it with forceps or this tool right here, pretty handy. Anything that you need to clean can either be cleaned with this trifectant or an alcohol on some gauze. So after surgery, good to clean the table. If you see the towel is dirty, to clean the towel, spray down the tray table, and yeah, make sure everything is good to go before you close it up. Okay, we are now in the dental room. So if there is a dental procedure that happened the day, you will be responsible to clean it. So first thing I like to do is to take a little gauze pad sprayed down with alcohol, and I just clean the top of it and everything, checking each side of this. I rotate it to see it's clean all the way around, move this around, make sure it's clean, tidy up everything up here, and then I move to the tools down below. First thing, if this right here is, if you find it in the drill itself, all you have to do is flip this little thing right there, and then it loosens it out, and you would just pull it out. Flip it back up, you would clean it, put that back on. Same thing, this right here is the polisher. Normally you would see like a little blue cap connected to it. You just rip the blue cap off and throw it away. Clean the rest, make sure to clean. I take it out and clean inside of it. I clean the entire rest of it. And then before I put it back on, move over. Same thing here, spot clean it, or don't spot clean it. Clean it as best you can, get all the blood and gunk all off. And then make sure this is always flipped to LS and water. So both should be facing that way or to the left. Lastly, this isn't very used often, but when it is, you could definitely tell, so just clean that as well. And then when you're done cleaning it, the next thing to do, if it was plugged in, you would see these light up, these ones right here. So you would flip them into the off position, which they are in now. There's 2 at the left side and 1 in the back that you have to flip. It's like a little lever almost, which is right here. You make sure it's on off. And then after that's all done, I like to unplug it, and then you wrap up the plug into this and just kind of hook it on where it could hook on. And then down here, it's kind of hard to see, but there's a little red lever. And what you want to do after each use is you slowly, and I cannot stress this enough, very slowly put pressure on it. Otherwise it will make a really, really loud sound that scares everybody. So very slowly just push it down and you'll hear the gas release, and it will release by itself. So you just leave that. I like to put it like not all the way down, just enough where the noise is not too bad. And then it will do the rest itself. And so that is the dental machine right here. Usually when there is a dental procedure, there's also dental tools that were used. So big thing is hospital assistants, this is a no-go. We do not touch whatever's at the top of here. We only focus what's in here. So after washing all of the tools, each of them have a place where they could go. You'll know what these ones or where these ones go because they fit very nicely in here. These are the winged ones. So if you look at them from different angles, you could see that they are curved right at the tip. These are just not tweezers, but not these. So they just live in the middle here. And then lastly, you got the flat ones. You could see they're very different from the curved ones. From the side and from the top, they are flat. So they live there. And then these can also be used, these, not sure what they're called, but if you ever see a little white rubber thing right here, you know it lives in the dental cart. So just keep that in mind. This one has it. Some of them probably won't have it because they exclusively live in the dental cart, but other ones that might get mixed up somewhere else, like these suture scissors, have the little white rubber. These ones wouldn't because they only exist here. And then, so that's all of that. If you see any blood pressure cuffs, they could either go in here or the other anesthesia machine, the oxygen machine, go in here. If there was a dental procedure in here, we would have to fill the other SIVO. This is the 3rd SIVO, and it would be the same thing. You just kind of unplug it, take our little yellow cap, replace this one, and fill it. So not too bad. And then after you're all done, both or all 3 of the dental machine, O2, and the tray, they all live in this little area right next to the sink. And yeah, say hi to Dash. Okay, still in the dental room. A lot of the times it's really easy to miss cleaning these after a procedure in here. So same thing, a little alcohol on a little gauze pad, and you just clean the spots that are dirty. It's super easy for these to get bloody. And the last one is the light up here. So wherever somebody would normally grab, just make sure to clean it. So anything like that you would normally grab. So next task of a hospital assistant is to make sure that the treatment rooms are clean. There are 3 of them, A, B, and C. Right now we are in A. Pretty cool cats. Anytime, a good indicator when somebody leaves is to see either the light on and the door open, or just like the door cracked and then you could take a peek and see who's there. Or if you don't know and don't want to possibly walk in on somebody in there, it always helps to just ask somebody and, you know, make sure that they already checked out. So after somebody leaves, what I like to do is, even regardless if they did not use the scale or did not use the table over there, I like to spray it. I spray both the table and the scale, everything, and then I take a paper towel and I just wipe it all down. If you ever see a thermometer out and just kind of laying there, oh, it's a little cotton piece, let's remove that. The thermometer out, what I like to do is get around 2 alcohol pads and I clean them. I like to fold them over each time, so I'm cleaning it with the clean side of the alcohol pad and not just keep rubbing the gross stuff on it. Always make sure that there are at least two treat bags, at very least one. We always like 2 just in case. There's also another treats in there. When you see this start to get really pale, this is just, I replaced it a few days ago, so it's good now. In the sink where the scale is, there are these other tablets in there, so just fill this to with hot water to this line, place 1 tablet in there, let it fizz for a little, and yeah, then good as new. Next, what you want to do is just kind of sweep everything up, make sure that there's nothing on the floor. If there are like chairs with a lot of hair on them, just grab a lint roller and kind of clean the chairs as well. When closing, what we like to do is place everything that can be placed on top of the tables. So that would include this thing right here, the little AC unit, the garbage when it's all empty, and the chairs. Doesn't really matter how you stack them, just as long as they're up like off the floor. So you could either use this table, you could use that table. A and B, you could stack the chairs, but C, the chairs are left on the floor. So just remember that. Last thing is to come around here. And there's nothing on here, but usually there is a doctor written, pets, maybe last name. Just wipe that off so it's a clean slate and ready for the next room. So that's basically the main gist of a lot of things. Another big important thing is after lunch is when usually all of the surgeries are done and catheters are ready to be removed. So it's really good to communicate about, you know, whether a catheter is good to be removed or if it should stay in until a certain amount of time. If you're ever uncomfortable about removing a catheter by yourself, just please speak up, ask somebody. You know, everybody here is gonna try to help you. A few other things are laundry. Laundry is a really big thing. The surgery laundry and, you know, just general clinic laundry are 2 different things that are washed separately. The surgery laundry is located outside of the surgery door. It's to the left of it. So if you're in the surgery room, to the left of the surgery door when you walk out is surgery laundry, and then in the dental room is where the other laundry from the clinic is kept. So that's really important to wash them separately. Another thing is just to make sure that things are being refilled. So what I would recommend is definitely just kind of take some time to just look around the entire clinic. So like everything behind me is a great example. A lot of things in the treatment room, like what's in different drawers, also in the different treatment, like where patients are kept, those rooms, A, B, and C, really good to look through the drawers. We always have to maintain just enough materials in them. A lot of the excess materials are kept in the surgery room, or sorry, not surgery room, in the drug room. If not, they could be kept in the surgery room. And so just making sure that all of those are topped off, whether it's pill bottles or, you know, different liquids like the little alcohol bottles, making sure those are topped off. Just a lot of refilling and everything. So that's a really big thing. And another thing is just time management. So yeah, there's a big priority of surgery animals first and then cleaning second. So always take care of your surgery animals first. Remove catheters if they have them, feed them, give them their medication if they have any, and take them on a walk / give them a litter box if they're a cat. After you're done all that, you can do what I do when I lock myself away in the surgery room to clean up everything, making sure everything is ready for close. Afterwards, that's when I start to do some of the refilling job. You know, I have more time and it's a little less of a priority compared to general cleaning and surgery animals, but it's still on the list, so don't forget about it. And then also there are different sheets in each room. There's one in the surgery room, in the treatment room, in the hallway leading to the exam rooms, in the bathroom, and I think in the break room. There are these sheets that look like that, and they're just weekly sheets. So if you really find yourself just kind of wandering, not really knowing what to do, take a look at the weekly sheets. Any questions about them, ask anybody around you. They'll be happy to help you. There's also monthly sheets as well. Ask about those. Oh, also there's another in the lab. Excuse me. The lab as well has one of those sheets. All you need to do is, so for the surgery room weekly, one of them is to scrub the sink. So if I scrub the sink, I'm gonna sign my name or my initials and just date it. And then in a week, you would just erase it and start again. But other than that, it's one main thing is just communication. Really, before doing not anything, but doing major things like removing catheters and like turning off O2 machines, it's really good just to ask in advance, like, hey, is it okay if blank gets their catheter removed, or should I wait longer, etc. Or if you don't see a food vote or medication in it, to ask if it's okay to, you know, if there is any medication that should be in it, or if we should be feeding them different types of canned food. There is AD, ID, there is a bunch of different ones. So it's really, really good to just communicate and ask before, just in order to avoid any doubling of things or missing it entirely. So that's a very, very important thing. And don't be afraid to ask questions. You know, nobody here is plotting on your downfall. Everybody here is very helpful and is willing to help you. And main thing is we just want it to run smoothly. So I wish you the best of luck. You got this.